I am Dr. Kiran Kumar K, consultant psychiatrist and director of the Nirvana Center at Marathahalli, Bangalore. Visiting a psychiatrist for the first time, lot of mystery associated with it, lot of stigma associated with it, lot of ignorance associated with it, and it is quite an enormous emotional reaction for a patient when he goes and first meets a psychiatrist. Lot of Dr. Google would have helped them to zero in on the psychiatrist of their choice. And the first question lot of my patients ask me when they meet me is, "Doctor, look at my face and tell me my diagnosis." Well, unfortunately, all of these things are very untrue, and what the patient expects and what is in store in reality are two different things. What does that mean? A psychiatrist, like any other medical professional, is a person who has a two-pronged approach. One, he has to fit in the medical pieces of the puzzle. Second, he has to understand the psychological or emotional reaction of the problem. So how does a psychiatrist approach a patient in general? This we call it as a medical model, and it is as simple as any other doctor, be it a cardiologist, be it a neurologist, be it a gastroenterologist, be it a general physician. The doctor as a psychiatrist also has the same medical approach. So the doctor probably will ask you certain questions pertaining to your present problem. This is called as the presenting complaint. He will inquire in greater detail about what made you come to the psychiatrist. He will also go back in the past, try to understand what is the past psychiatric history, what is the past treatment history, what is the past medical history. He would also like to know whether there were any allergies in the past. He would then go on to explore the family dynamics, be it the family of origin or the family of procreation, and understand the family dynamics. He will then do a complete head-to-toe examination because he is a medical doctor first and then a psychiatrist. For an ENT surgeon, he will do an ENT examination. For a gastroenterologist, he will do a gastroenterological examination. A cardiologist will do a cardiovascular examination. A psychiatrist need to do a specialized form of examination called as a mental status examination. So what is mental state? It is examining of certain higher cognitive functions like attention, concentration, then speech, thinking, how's your mood, what is your insight to your illness, what is your judgment, etc. These are certain things that the patient will be examined by the psychiatrist. Please note, in the course of the examination, the psychiatrist might ask you certain routine questions, certain routine examination, which might not be appropriate to your case, but please don't mind. It's a normal way of examining. There are set of formal questions which the psychiatrist would ask. So after all these things, the psychiatrist would make a provisional diagnosis. He'll send for some investigation, occasionally certain laboratory investigation to understand the medical pieces of the puzzle, neuroimaging in the form of CT and MRI sometimes, and a psychometric assessment to understand the psychological aspect. Following this, a diagnosis, a formal diagnosis is made, and a client-centered approach with a shared decision making is followed, and the patient is made to understand what are the reasons for his problem, what is the treatment, and a follow-up date or the ways of following up is clarified beforehand, and the first session ends. Occasionally, when things becomes difficult, the history is chronic, the history is challenging, the psychiatrist might take a second intake session or might get information from alternative sources, be it family members or friends, to understand the illness more. So dear friends, kindly note, what a psychiatrist follows is a complete medical model, and it is not an intuitive model. So kindly cooperate. It is as simple as you go to any other specialist. Thank you very much.